Good afternoon. Good afternoon, Senator Campbell, Senator Howard, members of the committee. My name is John Bailey. It's J-O-N-B as in boy, A-I-L-E-Y. I'm the director of the Rural Public Policy Program at the Center for Rural Affairs in Lyons, Nebraska. And today we provide you testimony in support of LB 472. We support LB 472 as we did LB 887 in 2014 and LB 577 in 2013 for the same reasons we supported both of those bills and for all of the supporting reasons you heard today. LB 472 is critical to rural Nebraska for the thousands of rural Nebraskans that are in need of affordable health care, for our healthcare infrastructure, and for all of treating all of the healthcare disparities that are apparent in all rural communities. But today we come before you in support of LB 472 for another reason, and it's a reason connecting LB 472 to another major issue that you all are facing this year, and that is the corrections issue. Today, in conjunction with Nebraska Appleseed, we released a report entitled LB 472 and Leveraging Federal Dollars to Reform Corrections, a report showing the benefits of a redesigned Medicaid program to our corrections program, our corrections population, and the state's taxpayers. A copy of that report is attached to my testimony that you received. Basically, to summarize this report, we use Nebraska corrections data, findings from other states, findings from research on connections between Medicaid and health insurance coverage, necessary treatments in the criminal justice system and criminal justice outcomes. In summary, our report shows four basic things. Number one, a lack of mental health services and substance abuse treatment is a primary cause of reoffending and recidivism and a return to jail or prison. A redesigned Nebraska Medicaid program such as proposed in LB 472 would help in our estimate, nearly 400 people per year from returning to prison. That reduction in the number of people reoffending and returning to prison would save the state, by our calculation using the average figure per offender from the Department of Corrections, would save the state of Nebraska gross about $11 million in 1 year. Our redesigned Nebraska Medicaid program could save additional state and county dollars that have already been invested or will be invested in corrections reform. We did not go into the local jail population. You heard that earlier from the county commissioners, but you can add that on top of this savings to the state prison and state corrections program. Obviously, LB 472 will not solve all of the issues you will be facing this year on corrections. It's a small piece of the corrections problem, but it's an important piece. It's an important piece for a population that is in need of very specific treatment, very specific. The lack of those treatments affect their ability to stay out of the corrections population, to stay out of prison. Reducing the numbers of people in jail, reducing the recidivism rate for prison is critical, and you all know that. And it's one of the reasons we have now the problem that we're facing in our corrections system. Obviously, the research we use in the report, I lead you to all of that research in the report. Research clearly shows recidivism can come from a lack of health coverage. There's a consensus among national and Nebraska research and analysis that mental health and substance abuse treatment are what many in the corrections population need. Examples from national research and from other states clearly show linking people to coverage and necessary treatments work in reducing criminal offenses and recidivism. Since traditional Medicaid is unavailable to most of the correctional population and private health insurance is unavailable to most, Nebraska needs LB 472 to make these necessary connections. Nebraska taxpayers, public safety, as well as those in the corrections population will be the beneficiaries. I think one of the interesting parts of our report, we outline some of the steps you have already taken in past years to provide these treatments. You haven't taken the path to get most of the people who need these treatments to get the treatments and to stay out of the corrections population. So for all those reasons offered, we support LB 472, ask the committee to advance it to the full legislature. I'd like to thank Senator Campbell and all the other sponsors of LB 472 for keeping up the good fight on this critical issue to so many Nebraskans. Thank you.
Thank you, Mr. Bailey. Are there questions? Seeing none, thank you for your testimony.